Hello everybody, welcome back. Our topic today is a common medical sign. Did you know it? Our topic today is fever. What is fever? Fever is an elevation of the body temperature above the normal circadian range. Fever is based on individual situation. Someone can have a relative, low or high body temperature. Body temperature has a diurnal variation, changes throughout the day. Rectal temperature is more than 0.6 degrees Celsius than the oral temperature. Body temperature ranges from 36.8 degrees Celsius plus minus 0.4 till 37.7 degrees Celsius. In case of fever, the body temperature in the early morning is more than 37.2 degrees Celsius and the auxiliary body temperature is more than 38 degrees Celsius. What are the different stages of fever? There are 3 stages of fever. 1. Stadium incrementi, which is feeling cold, goosebumps, and shivering. 2. Fastigium. 3. Stadium decrementi, which is in crisis and in lysis. Can anyone tell me what are the fever symptoms? Fever symptoms depend on what is causing this fever. Symptoms of fever may include sweating, shivering, shaking, chill, headache, myalgia, arthralgia, lack of appetite, dehydration, malaise, and somnolence. What can very high fever from a temperature of 103 Fahrenheit till 106 Fahrenheit cause? This very high fever between 103 till 106 cause hallucinations, confusion, irritability, and convulsions. Furthermore, what are the different types of fever patterns? First, we will mention them, then we talk about the description and clinical conditions of each one of them separately. 1 is a continuous type, 2 remittent, 3 irregular, 4 intermittent, 5 recurrent, 6 relapsing, 7 hectic, 8 inverse. So we've mentioned the types of patterns. We will talk about now the description of each one and the clinical conditions. First of all, the first one is the continuous pattern of fever. The description is a fluctuation of less than 0.5 to 1 degree Celsius. And the clinical conditions is pneumonia, erysipelas, typhoid fever, drug fever. Second pattern is the remittent fever. Fluctuations are more than 1 degree Celsius, but not below 37 degrees Celsius. This remittent pattern occurs in clinical conditions like TB, localized suppurations, septicemia, bronchopneumonia. Third type of pattern is the irregular type of pattern. The description of this type of pattern is a fever pattern that cannot be systematized. Clinical conditions in which this irregular pattern can be seen is suppurations and septicemia. Number 4 is the intermittent type of pattern. We can see a great fluctuations in the temperature, return to baseline, and to normal reappears at different intervals. Clinical conditions in which the intermittent pattern appears is the tertian, in which is the Plasmodium falciparum, quartian, which is Plasmodium malaria, 5-day fever, which is the trench fever, irregular cholangitis, digestive neoplasias, urinary tract infections. As for recurrent, also called relapsing type of fever, the description of this type of fever is a febrile episode which is separated by intervals of normal temperature. The clinical conditions in which this type of fever occurs is Hodgkin lymphoma, endocarditis, relapsing fever, and furthermore a hectic pattern of fever described as a daily temperature excursion of more than 1 to 3 degrees Celsius. The clinical conditions in which this hectic pattern of fever occurs is intermittent bacteremia, Epstein-Barr virus, Crohn's disease, and juvenile rheumatoid arthritis. The last type of pattern of fever is inverse pattern of fever. It is described as a higher in pattern, higher temperature in the morning than in the evening. The clinical conditions in which this type of pattern occurs is merely TB. Fever patterns cannot be considered pathognomonic for a particular infection. Fever pattern can be altered by antipyretics, antibiotics, and corticosteroids. What is the difference between a hypothermia and a hyperthermia? First, we'll talk about hyperthermia, also called hyperpyrexia. It is an elevation of body temperature above the hypothalamic set point. It is more than or equal to 41 degrees Celsius due to insufficient heat dissipation. What about hypothermia? It is an abnormally low temperature below 35 degrees Celsius, also 95 degrees Fahrenheit equivalent, rectally. May occur in various situations like reduced movement, water immersion and in near drowning cases, and prolonged unconsciousness in low ambient temperatures, especially in combination with alcohol intoxication, drug overdosage, stroke or head injury. Also can be seen in severe hypothyroidism. What are the characteristics in the different temperatures in hypothermia? Like in 36 degrees Celsius, we can see an increased metabolic rate, also vasoconstriction. In 35 degrees Celsius, we can see a shivering maximal and impaired judgment. 34 degrees Celsius, the person is uncooperative. 33 degrees Celsius, a depressed conscious level. 28 to 32 degrees Celsius is a progressive depression of conscious level. Muscle stiffness, failure of the vasoconstrictor response, and shivering. Bradycardia can also be seen, hypotension, G waves present on the ECG, and risk of arrhythmias. Less than 28 degrees Celsius of hypothermia, the patient is in coma. Patient also may appear dead, absent pupillary and tendon reflexes. Spontaneous ventricular fibrillation can also occur. As for a temperature of 20 degrees Celsius, asystole, profound bradyarrhythmias occur. Thank you for watching and looking forward to see you with a new topic in the next video. Bye.